Hi, I'm
Ryan?
29 years old, HIV positive. I learned that I am positive for HIV 4 years ago. No signs nor symptoms. I just decided to take the test after attending an HIV orientation at the office. What changed after that? I still go to work, still play, and go out with my friends. But me and my family are more expressive in our love and care for each other. We, my friends and office mates, are learning more about HIV and AIDS since then. I do not feel different because they know HIV cannot be transmitted by handshake, sharing utensils, nor casual kissing. No stigma, no discrimination. I'm glad to be working for a company that strictly observes a no discrimination policy for persons living with HIV. And I'm glad to be working with people who accept me for who I am.
Ignorance breeds myth and misconception. It is the same ignorance that also promotes the practice of risky behavior, making people vulnerable to the threat and infection of HIV and AIDS. At the moment, data from the Department of Health shows that every day we are getting 5 to 6 new cases of HIV. This is far higher than the 2007 figure of 1 case per day. Republic Act 8504, or the Philippine HIV and AIDS Prevention and Control Act of 1998, articulates that workplace should have policies that promote the information and education on HIV to its employees, and that any person found positive for HIV who is also a worker should be protected from any stigma and discrimination in the workplace.
In-isolate ako sa isang isolation area sa Dubai. Nakulong ako 3 weeks. Ang sabi sa akin ay HIV positive ako. Doon ako na-shock. I was confused kung nga lang inaasahan sa family ko dahil gusto ko rin makatulong sa kanila. Ang pinirmahan kong kontrata doon is 2 years contract, pero hindi ko na siya natapos yung kontrata kasi nga kailangan kong i-follow yung guidelines nila na kapag HIV positive ka na, kailangan bumalik ka na sa Pilipinas.
The International Labour Organization fights for the rights of individual workers. We look at how to promote decent and productive employment for all. In 2010, the ILO adopted Recommendation 200. Recommendation 200 promotes key principles centered on recognizing HIV and AIDS as a workplace issue and as a gateway to universal access to HIV and AIDS prevention, treatment, care, and support information services.
It is the responsibility of enterprises to facilitate their workers' right to know and right to act on HIV and AIDS. On the part of the Department of Labor and Employment, we continue to intensify the implementation of Department Order Number 102-10, Series of 2010, in pursuit of occupational safety and health for all workers.
The Implementing Rules of Philippine AIDS Prevention and Control Act of 1998 mandates the Civil Service Commission to take part in the information and education campaign for HIV and AIDS prevention and control. With proper awareness and information, our 1.3 million civil servants are given the opportunity to make informed choices while also protecting the rights of those among our ranks who are living with HIV and AIDS.
With HIV and AIDS, it's simple. You have sick employees, you get poor performance, and that drags down business. Shell supports the Philippine business sector response to HIV and AIDS because we believe that by contributing to the response, we help employees remain productive and healthy.
Our promotion of workers' rights revolves in ensuring that our members, the Filipino workers, are actually able to exercise their rights. We provide training to our members so that they will be able to bargain for provisions on HIV and AIDS in their collective bargaining agreement. These are direct contracts between employees and employers, and if there are cases such as workers to be found out to have the infection of HIV and AIDS, their rights will not be compromised.
While employers are obliged to facilitate the awareness raising as regards workers' rights concerning HIV and AIDS, we believe that it is also the worker's responsibility to educate himself.
International standards and national laws addressing the issue of HIV and AIDS in the workplace is not just another responsibility that we face as members of society. It's a social responsibility. We look at HIV and AIDS as a workplace issue. We need to improve productivity and growth that is sustainable and inclusive.
Mapapansin natin ay dumadami ang talagang nadadiagnose ng HIV. Ang bulk ng nadadiagnose at ang karamihan nito ay nasa productive lives nila. Kinakailangan na magkaroon ng impact yung information, education na maibibigay sa workplace na magbibigay ng encouragement sa kanila na kung sino man yung mayroong mga exposure sa HIV/AIDS na posibleng mayroong mga risky behaviors ay mag-undergo ng HIV test para maaga pa lang ay pahaba pa nila yung buhay nila na hindi na nila abutin yung panahon namin na halos lagpas na sa kalahati ng mga kabatch ko ay namatay.